Florida is set to become the first state in the nation to remove school vaccine mandates. By the end of the calendar year, students will no longer be required to have vaccinations for diseases like hepatitis B, chicken pox, and other contagious diseases. State Surgeon General Dr. Joseph Ladapo says the mandate removal gives power back to the individual and allows parents to make informed decisions about what goes into their children's bodies. He says the state will also push the state legislature to remove laws that require vaccinations for other diseases, including mumps, measles, tetanus, and polio. He called the current requirements an immoral intrusion on rights.
Every last one of them is wrong and drips with disdain and slavery. If we want to move toward a perfect world, a better world, you can't do it by enslaving people in terrible philosophies and taking away people's freedoms. That's not the path. That's not the path. We have to find alternative pathways.
The decision from the Florida Department of Health has been met with criticism, including from President Donald Trump, who said that some vaccines are not controversial and should be used. Dr. Ladapo later clarified that vaccines would still be available for parents and children, but would no longer be required for children entering public schools. In 2021, Florida instituted a religion exemption for certain vaccinations, which parents can file for on behalf of their children without proof of religious beliefs. Still, local health experts like pediatrician Sal Anzalone fears the removal of the vaccine mandate will mean illnesses he treated as a young physician will resurface.
So of course, those kids who are in school, if they're fully vaccinated, there's less likely for them to have an opportunity to get sick. It's the ones that are unvaccinated are going to be most at risk. And unfortunately, those kids are the underserved areas, the ones that are probably in areas where there's less affordability for health care, and kids who are maybe not getting to the doctor because of whatever barriers are available to them. They're the ones that are going to be really impacted. And then there's, again, I think vaccinating is nothing more than the best way that we can really minimize the impact to healthcare, improve the quality of life for our people, and most importantly, our society. And the children are the greatest resource we have in our country. And this is the greatest resource that we need to protect. And vaccinations is the best way to do that.
For more on Florida's move to eliminate school-mandated vaccines, we're joined by Dr. Scott Rivkees, a former state Florida Surgeon General and current professor of education in the School of Public Health at Brown University. Dr. Rivkees, thank you so much for joining us.
Yeah, thank you. It's an honor to be here.
So I want to start with your op-ed that I read in the Tampa Bay Times. You said that you dread seeing children suffer again from illnesses that have been eliminated in the U.S. through vaccinations. How concerned are you?
I'm very concerned. When I was a pediatric resident, as I wrote in that piece, the first patient I took care of was a young boy who ended up having brain inflammation, encephalitis due to chicken pox. There were 4 million cases of chicken pox a year before the vaccine. Now we don't see the dreaded complications of this. So in terms of chicken pox, vaccines against Haemophilus influenza, other ones, there are a lot of vaccine preventable diseases that we just don't see anymore. And if we roll back these vaccine requirements, we're bound to see them again.
So the Florida chapter of the American Academy of Pediatrics says this decision puts Florida children at a higher risk of getting sick and that it could have a ripple effect across our society. Do you agree with that assessment?
Absolutely. So there are broad effects. When you start having outbreaks in communities, it'll affect education, it'll affect commerce, it potentially can affect tourism. So it goes beyond the schools. Children we know spread infections more than adults do. And if you have outbreaks in schools, it definitely will have an impact on the community, both in terms of infections, but also how people perceive how safe it is to go out into the community as well.
So help me to understand the risk to people beyond the child that doesn't get vaccinated. I'm thinking, okay, I got my child vaccinated. Why should that still concern me if other children that my child is exposed to are not vaccinated?
That's a really, really critical point here. So to have, first, we all agree that schools should be places children go where they're safe, healthy, not risk of disease spread. And for vaccine protection, two things have to happen. First, a parent has to vaccinate their child. But for your child being protected, you're also dependent on other parents vaccinating their children. No vaccine is 100% effective. So we are dependent upon individuals having sufficient levels of vaccination to get something that we call herd immunity. So the decision you have for vaccinating or protecting your child impacts other children as well.
Could the decision not to impact children impact other high-risk populations? I'm thinking seniors.
Yeah, absolutely. So there, first within the pediatric population, you have some children who are immunocompromised, some children who are on medications that will suppress their immune system as well. Some children being treated for cancer. So even though these children may have been vaccinated, they can be susceptible again. So which is why for those children to be able to go to school, you really have to have a sufficient level of protection within the school population. And then also, children can spread diseases beyond the walls of the classrooms. Some children will interact with grandparents, older other people in the communities, and with some of these diseases, children can actually spread them before they come out with symptoms for it. So if you're being treated for cancer, again, immunosuppressed, you actually could be at risk if you start seeing community outbreaks.
So supporters of removing these vaccine mandates say that parents should ultimately be the ones to decide what goes into their child's body. What is your response to parents who simply have concerns about vaccinations?
Yeah, I mean, this is something that's an important issue, and it's something that society has actually decided that society will do certain things for the benefits of society, and that parents' autonomy is not absolute. So, for example, let's suppose you bring your child to the emergency room, your child is deemed to have a very serious infection and needs to have antibiotics. Well, and you want to take that child home. Well, the physician will actually get a court order saying that's not in the interest of a child. The Supreme Court has actually ruled on this as well, saying that for the protection of society, for protection of children, vaccines can be required and that they are neither arbitrary nor are they oppressive. So these are decisions that society has already made that for the greater good, that we can require vaccination for children. And we also have to realize that giving somebody absolute personal freedom not to vaccinate their child will actually impact the freedom of others. So if we get to the point now where vaccination rates drop and we start seeing outbreaks of chickenpox, outbreaks of measles, increased outbreaks of whooping cough, other people in the community are going to be afraid to go out for fear of getting infected. So their rights and liberties are actually being affected as well.
So Florida already has a religious exemption for these student vaccinations. So theoretically, if a parent already wanted to avoid these vaccines, I suppose they could, or at least attempt to. I mean, so do you think really removing these vaccine mandates will really impact the rate at which we see, parents not vaccinate?
Well, first, in terms of religious exemption, no religion forbids vaccination. And what we're seeing now is these exemptions being used much more liberally than in the past, not just in Florida, but also nationwide. So in Florida, we used to have a really good vaccination rate for children going to kindergarten, typically was greater than 95%. But now it has dropped in the state, and actually in some counties, if you look at some of the recent information published by the Department of Health, for children going to kindergarten this year, the vaccination rates are close to 80% in some of the major counties in the state in which we only have a religious exemption. So these religious exemptions are really being used very, very liberal in this kind of a situation. So the fear is that if you even take away the requirements further, that this can drop to really a precarious situation.
So our current Surgeon General, Dr. Joseph Ladapo, hopes that the Florida legislature will repeal vaccine mandates for measles, whooping cough, mumps, and polio, among others. What is your message to state officials as they will ultimately make that decision? We'll have to vote on that.
Yeah, well, first you have to look at what could the potential consequences be. So as vaccine rates start dropping, and we will start seeing this, you'll start seeing outbreaks here and there. It won't happen all at once, but there is a projection done by Stanford University looking if vaccination rates just fall by 10%. Nationally, you could expect to see almost 11 million cases over the next 2 decades. And in Florida, somewhere between 800,000 and 1 million cases you would project over the next 2 decades. So this is going to have dire effects both at so many different levels. First, on children. The children are going to become ill with this. Measles has a mortality rate of about 1 per 1,000. So if you have 1 million cases of measles in Florida, you're talking about 1,000 deaths. We talk about measles because that's one of the most infectious, but again, in terms of the ones that are in legislation, polio, do we want to see individuals have paralytic polio again? Pertussis, we're already seeing uptick in cases of pertussis as well. So there is a human toll that we will endure, and it's going to affect our children. It's going to affect our society.
If I can end on this, Dr. Ladapo called vaccines, used the term poison, and said there's regret from many who took the COVID-19 vaccine. You were Surgeon General during the pandemic. What is your reaction to a top state official, health official making a comment, making those types of statements?
Yeah, first, let's look at the facts. Over the first half of the pandemic, when COVID vaccines were widely promoted in Florida by myself and by the governor, Florida had among the highest vaccination rates for individuals at risk, and we had actually one of the lowest mortality rates. When the governor shifted to a position of not endorsing the vaccines and vaccine uptake fell, Florida went from having among one of the lowest mortality rates to among one of the highest mortality rates. So the COVID vaccines clearly reduce the risk of severe COVID, which involves hospitalization and relies on death. 1 million people died during this pandemic due to COVID. Based upon vaccines being used, it's projected it saved at least 2 to 3 million lives. And of those million individuals who died, 300,000 of those deaths were estimated to be preventable. So even though there's a lot of controversy about the vaccines, a lot of this is not grounded in science, and rather there is ample evidence that these vaccines really saved lives.
Dr. Scott Rivkees, we thank you so much for your time. Thank you.
Thank you for having me.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.